Sudan is grappling with a devastating humanitarian crisis. A brutal conflict has engulfed the nation, displacing millions and leaving countless people in desperate need. The fighting began in April 2023, stemming from a power struggle within Sudan's military leadership. Rapidly, the situation escalated into a full-blown war, with civilians caught in the crossfire. The conflict has had a catastrophic impact on Sudan's already fragile healthcare system. Hospitals and clinics have been destroyed or damaged, leaving many without access to even the most basic medical care. Medical supplies are scarce, and many healthcare workers have been forced to flee, leaving those remaining overwhelmed and ill-equipped to handle the crisis. The violence shows no signs of abating, and the humanitarian situation continues to deteriorate. The international community must act urgently to provide aid and support to the people of Sudan. The conflict in Sudan has resulted in a severe shortage of essential medicines. Supply chains have been disrupted, and many pharmacies and hospitals have been looted or destroyed. The shortage of medicines is having a devastating impact on the health of the Sudanese people. Chronic diseases are going untreated, leading to preventable complications and deaths. Infectious diseases such as cholera and measles are spreading rapidly due to a lack of vaccines and other essential medicines. Pregnant women and newborn babies are particularly vulnerable, with limited access to essential care, putting their lives at risk. The situation is dire, and the lack of access to essential medicines is exacerbating the already immense suffering caused by the conflict. The conflict has severely disrupted Sudan's pharmaceutical production and distribution networks. Factories have been damaged or forced to close due to the fighting, leading to a sharp decline in the production of essential medicines. Transportation routes have become too dangerous, making it nearly impossible to get medicines to those who need them. The breakdown of these critical systems has had a ripple effect throughout the country. Hospitals and clinics that are still operational are struggling to function with limited supplies. Patients are forced to travel long distances, often at great risk, to find the medicines they need. The collapse of the healthcare infrastructure is a major contributor to the unfolding humanitarian catastrophe in Sudan. Section 4. Displaced and vulnerable: the plight of Sudan's displaced populations. The conflict has forced millions of Sudanese people to flee their homes in search of safety. These internally displaced persons, or IDPs, are living in overcrowded and unsanitary conditions, making them highly susceptible to disease outbreaks. Many lack access to clean water, food, and sanitation, further increasing their vulnerability. Children and the elderly are particularly vulnerable in these settings. Malnutrition rates are soaring, and preventable diseases are spreading rapidly. The lack of access to healthcare services exacerbates these problems, turning already dire situations into life-threatening crises. The plight of Sudan's displaced populations is a stark reminder of the human cost of this conflict. Section 5. Under attack: the targeting of healthcare facilities and workers. In a blatant disregard for international humanitarian law, healthcare facilities and workers have been deliberately targeted during the conflict. Hospitals and clinics have been bombed, looted, and occupied by armed groups. Medical personnel have been attacked, threatened, and prevented from carrying out their life-saving duties. These attacks constitute grave violations of international law and are unacceptable under any circumstances. The targeting of healthcare facilities and workers not only deprives civilians of essential medical care, but also creates a climate of fear and impunity. It undermines the very foundations of healthcare delivery and puts countless lives at risk.